Postpartum depression, or PPD, affects 10 to 15% of women in the year after their child is born. In most cases, the mother will recognize some symptoms, including restlessness, constant crying, or questioning of her ability as a parent.
Postpartum anxiety looks much like what anxiety would look like in anybody. The obsessive compulsive component is characterized generally by thoughts of harming the baby. What if I drop my baby? What if I drown the baby? What if I accidentally stab my baby? Thoughts that are very disturbing to the mother and often make her think she's gone psychotic or gone absolutely crazy, and in fact they're part of an anxiety disorder.
But in rarer cases of postpartum psychosis, mothers can lose touch with reality, and it can lead to more serious issues like suicide or the killing of a child.
Whereas psychosis is much more of a biological disorder, it's very much of a medical emergency, and it's characterized by the woman being very out of touch with reality. She may hear voices, she may imagine people telling her to do things. When you hear about the women who kill their babies, they're often suffering from postpartum psychosis.
It's important for family and friends to act as a support system for a new mother in the weeks after giving birth.
We always need to be concerned about the safety of the mom in these situations, or at least the health of the mom. So if mom is depressed or anxious or expressing concerns or really just seeming not like herself, and it's 2 weeks after this baby has been born, mom needs help. She needs a lot of support from the family. She needs support from friends.
Burnett recommends family members or friends who notice a mother who may be having depression symptoms help in any way possible.
If possible, the husband or the spouse should stay home from work for a period of time and let mom get a lot of rest and make sure that she's eating properly, taking note so she's not worrying about housework and cooking and cleaning. She should be really very pampered in the first month or so after giving birth.
The most important part about PPD and dealing with it is getting help.
My advice, if you even think maybe I have it, maybe I don't, go talk to somebody. The most it's going to cost you is an hour of your time in a therapist's office. Go talk to somebody just to find out, or call the postpartum hotline out of San Diego, which the number should be on your screen, and talk to someone. And the thing I'd most like people to know is it's normal. There's nothing wrong with you. You didn't do anything wrong. You're not a bad mom. You're not a bad person. But if you're not enjoying your child, and if you're not enjoying at all being a mom, that you should talk to somebody, because it probably is a chemical imbalance that's not your fault, but that can be treated. And you don't have to keep feeling this way.